Why do I have to do this? I don't get it. Well, talk about the raging army.
They were like, he's got a UTI. This is Lisa.
And this is Lana.
We are two old friends,
A nurse.
and an actor who are both taking care of our parents.
I got some troubles and I don't know what to do. I got some worries and I'll share them all with you. Sometimes we'll talk it out, or maybe scream and shout. It's always easy when I see you through with you, 'cause we are two old friends talking to old friends. Not too old, too old.
5 UTIs and a very bad year. This is a podcast about what to expect when you're not expecting it.
How did I not catch this?
Two old friends talking to old friends.
Today's episode is going to be on UTIs. And our first question is, what the heck is a UTI? Lana, Nurse Lana.
So what it is, pretty simple. It's a urinary tract infection, so UTI. And simply put, it's an infection of either the tube that connects from the inside to the bladder or the bladder. So it's infected.
And then the second thing is that 16 to 20% of old people, when they get a UTI, show no symptoms at all. This episode is all about UTIs and how you handle that scary issue. Let's get started. When I think of a UTI, honestly, before taking care of my dad, UTI for me was you had sex and you didn't pee right after. That's what I thought. I didn't know. And like when my mom first said, I was living in Los Angeles and my mom was like, your father's had a UTI. I'm like, Dad? Like, I don't mean to sound stupid. Obviously, it means urinary tract infection, and men have urinary tracts. I get that. But I'm going to be honest. I just thought it was kind of a woman's thing. How many guys did you know who had a urinary tract infection?
Well, and if you think about the anatomy, like the tube for the lady is, I don't know, but it's little. And then the tube, depending on, but let's just say it's a 6-inch tube. Yes, I don't want to think about that, but it's a longer tube. So yeah, guys, it's definitely more common in women. But here we are.
Yeah.
Your dad, my dad.
Because my dad has MS, he has certain things that happen. And I can't tell you, I haven't taken care of a ton of people, but I can say that I know what happens to my dad. And I'm also on Facebook. I'm part of a group of caregivers for people with MS. And UTIs are very frequent. Very common.
Yeah.
And it's not just old people. It is people. Yeah. So, I mean, and you got to figure.
Anybody who's immunocompromised. Their immune system isn't working.
Their immune system, or they're sitting a lot, or
that is true, because you don't empty.
You don't empty,
right? So there it sits.
Mm-hmm.
Yeah.
Anytime that you're not active or moving around, you might not be changing your underwear as often as you should have. There's a lot of things that can create kind of like, I wish I could remember the word that this recent nurse that was taking care of my dad said, something like, it's a hotbed of like,
It's a breeding ground.
It's a breeding ground.
Yes.
She's like, bacteria loves dark and warm and,
moist.
It doesn't sound nice.
No.
So we took notes about symptoms of the UTI. So I'm just going to read those briefly and see what relates and then what doesn't relate to our older parents.
Yeah.
So painful urination, stinging.
Yeah.
They also said stinky pee, which that's just me not drinking enough water.
Exactly. But there's you sit down, there's kind of a plume where you're like, okay, I'm not meeting the water goals today.
I'm such a camel anyway.
I feel like I need to drink of water right now. Anyway.
Totally. I remember when back in the 80s, when the first time they came out with the 8-ounce glasses of water, I remember I was like, a week? Because I was like, y'all can't mean every day. That's insane.
Yes.
So, no, it's every day, which is insane still to me. But anyway, that will help your stinky pee. Then, frequent urination. Yeah, obviously. When I had a urinary tract infection when I was younger, really, it was just the basic symptom of
I have to pee.
Exactly. I never went farther than that. I was just like, what the heck is this? And someone's like, you've got a UTI. And I was like, oh no. And then I went on antibiotics and it was gone.
Yeah.
I think that's what I remember. And then if you have blood in the urine, obviously. They also said high fever. Like if you do move along, it is an infection, and a fever is something that is when your body is fighting an infection, right? So high fever, and then shaking and chills, which is what your dad had is the full-on shakes, right?
Mm-hmm.
So then there's nausea and vomiting, which I got to figure if you've got a UTI that's causing that, it has gone too far. And then you've got back pain. You've got...
And I want to say that, Lisa.
Yeah.
Like, that is really interesting because the kidneys are like towards your back. So we're talking like if you have back pain, it has gone past the bladder and now it is infecting the kidneys. So if you have back pain, like, and that's hard to discern, it's like, oh, did I just drain whatever? But back pain is a late
symptom.
Yeah.
That's really
But anyway,
that's good to know.
Yeah. So that's why they're like, well, back pain, why? Well, it's because the kidneys are there.
It's already gone so far. For our parents, for the older generation, for the symptoms are so different.
Yeah. If they even have them.
I
mean, that's, which I don't, like, when you said, you had a UTI when you were 23 and rocking it out in the single scene. I remember those days, Lisa. But here we are today. I mean, it was quite obvious. It's like, how can you not have a symptom of it? And I remember thinking, like, okay, and the doctor, well, it's different, blah, blah, blah. But they don't get them. They do not
They don't get the symptoms. And if they do, and this is where it's really, if I can give any tip to anyone, it is after the first couple of UTIs that your parents have had, start to like, what happened before this happened?
Yeah.
And try to remember. Right. Because it took us, I think, like 5 UTIs and a very bad year with my dad before we were like, you know what? He gets really mean, belligerent, argumentative over stupid stuff. Where you're like, now, I love my dad, but he can be like that about silly things sometimes anyway. Right. MS actually does also cause a lot of that. Yeah. Being incapacitated and vulnerable, hey, that can make us all...
It can make you a little cranky.
It can make you a little cranky.
I know. So it's hard to discern.
It is hard to discern.
Yeah, but...
It was actually, when we found out, we were never surprised. By the end of it, we were like, oh,
we forgot to think about the confusion.
Exactly. The confusion, I can't remember these words, and getting angry. It starts, and what we found out is whether he starts to get a urinary tract infection or his body is ripe for it, I don't know. But he would start to get cranky. And I think that was an early symptom. That's one of his earlier symptoms. Yeah. And while somebody else might end up with like that back pain you were talking about, your dad was shakes. And that's like, it's gone too far. My dad was, and you kind of associate this with MS anyway, but his legs would get really stiff, like really stiff. Yeah. And he would try to get back when he was able to get into his bed, and his legs would like, I can't get them up. I can't get them on the bed. And my mom would have to like lift up his legs.
Just not flexible. Yeah. Just
no
the flexibility.
Like locked. Yeah. And which that is not what you would think of as a UTI, but that is an infection. And we always say that he goes, and especially that year when things were going really bad. He went sepsis. Yeah, he had 5 of them, and he went sepsis each time. Sepsis, septic, however you say it, sepsis, septic. Again.
So that is bacteria. So we'll just quick do good. Like that means there's massive infection. It goes to the blood. And now that infection is throughout your body.
Yep.
So it is
no longer in the bladder.
Extremely serious. And you literally can die in like 6 hours. So, and we'll talk more about that later. But yeah, it's a very serious thing.
It is very serious. And honestly, any doctor was like, I don't know how he's survived them. I think, and we always said he goes sepsis fast. But here's the thing. If you don't know the symptoms before, he may have had a urinary tract infection for a week.
Right.
We just didn't catch it. So he didn't go sepsis fast. It's been sitting there for a frickin' week.
Yeah. Yeah.
And now we have him on a catheter so we can see. Now in the bag, if it's dark amber color, he's not drinking enough water, he's going to go. Or hazy and cloudy. Yeah. That's hard to see in a toilet maybe, but in a bag, you're like,
you can totally see. But I think you can see it in the toilet
too.
Or just look it up on your weather app. Either one. It's clear and cloudy. It's a sunny day. It's yellow. There's some parallels there, Lisa.
Yeah, there is. So,
but when you think about, when it's in a toilet, it's in water, so it dilutes it. So it can make it more, but I feel like you can still smell it.
Yeah, I think you're right.
When I was a nurse in the hospital, I was like, oof. Yeah.
Yeah, absolutely.
Yeah.
So we talked about the confusion, the cranky, the belligerent.
And I do want to kind of comment on that too. Like your dad cranky, but if I can emphasize like the confusion.
Yeah.
And then you think, oh my gosh, my mom is early Alzheimer's. Here we go. And so, now what am I going to do? I'm working full time. What am I, but anyway, you got to stop and say, this is kind of new. Is there something that like if you can just remember one thing from this, it's just like the confusion, the anger, the personality change. Because it could be something different for your mom and dad.
So we're asking people to look at your particular parents' symptoms before they go to the bad place of sepsis. Right. And everybody, we are finding, might have similarities, but very often they are different. After the first couple, you do start to see it, and that is almost the assumption. By the end, that becomes our first assumption. Dad's like pissed about something. We're like, he's got a UTI.
I know, and I totally did that with my mom. So
which is awful because truthfully, didn't we hate it when you're cranky?
Did you take your meds?
Yeah,
exactly.
And when we were younger, and someone would be like, "Oh, are you having your period?" And you're like, "Shut up! It's not that. I'm actually angry." I wonder if that's how it feels. That they're like, "Oh, Dad, are you having a UTI? We're going to have to get you tested."
So we did the urgent care, the whole thing. Okay, and she was pissed that we went to urgent care. So we go through this whole thing. Mm-hmm. So I go to fill the prescription, and they're like, "Oh, the doctor called one in on Friday, and she forgot." So we go through this whole visit of urgent care, and there was the prescription. Yeah, so we didn't need to do all that. So
wow,
way to spend the healthcare dollar.
Just recently, my dad did have a UTI. We had a huge issue. He's got an ileostomy, and we had a huge issue. Ended up in the hospital right before Christmas. And then we were back home, and then we had to turn around, go back. And then they did a search and a huge culture to find that he had a UTI. It did not manifest through a fever. So nobody knew. Nobody knew he had it. He was in the hospital for 5 days, most likely, and he was exhausted and tired.
Oh, I got it there.
But, it's possible, or it's possible he had it before he went there.
Yeah, that's true.
And we were so focused on the stoma blockage issue that no one was even thinking about.
Looked at the whole person.
Exactly. Mm-hmm. And then also I do believe they did a urine test, but they didn't even catch it there because it was a bit more, it was a different type of bacteria or something. I don't know. It was crazy. I won't even go into it because I don't know the full-on details. But I do know that nobody caught it until he started doing cultures and then happened to find it, which explained so much of what was going on. But nobody saw it because he did not have any symptoms. And the truth is he didn't even have his cranky symptoms. So what the heck do you do then when he's this normal symptoms? He wasn't even manifesting. So now we maybe have to re-look at it. The next thing we want to talk about is what you can do to minimize the chances of getting the UTI.
Now, my mom's had a couple, and the doctor said there's really two things that you can do to prevent UTIs in females. Number one, the pelvic floor. There's physical therapists that do the pelvic floor exercises, and there's a thing with that. So talk to the doctor about that.
Awesome.
And then the other thing is that's very simple, that a lot of times people that are over 50, you're in menopause, estrogen, you need estrogen. There's an estrogen cream that you can put on the vaginal area, and it prevents bladder infections. So it's extremely helpful for elderly women. If they're getting bladder infections all the time, you might want to talk to the physician about getting a estrogen cream. Game changer.
The other one is my dad. Once he had those massive UTIs over and over, they put him on a low dose of an antibiotic for a sustained period of time, which, what do they call that?
Prophylactic?
Yeah, prophylactic.
Yeah.
And which in general is a bad idea to be on an antibiotic too long. But here my dad is at 83 years old or 81 at the time.
That's the least of our concerns.
That's our least of our concerns if it
Exactly.
shouldn't be on an antibiotic for too long. So that is another way in these extreme circumstances.
Right.
It's not something we do for a normal situation, but when you're dealing with these aging parents, that's what we have to do. So
well, and my mom went on that too, and she actually saw like that kind of level of treatment comes usually from a urologist, which is a fancy name for a bladder doctor.
Right.
So and sometimes your family doctor will do that too, but yeah, that's a really good point, that it's more of a nothing's really working. The other thing your dad's taking that I want you to talk is the cranberry.
Absolutely. The cranberry juice. That is a good thing, even for anybody who's trying not to get a UTI. But you cannot do cranberry juice that has any sugar in it, unsweetened cranberry juice. And if you've ever had that, it's
like
crap.
I'm puckering. Just
it is a
hearing
puckering.
That story.
Exactly. So cranberry juice with unsweetened, no other juice in it. You can't do the cran grape. It will make your UTI worse because it gives it sugar to feed on. So no. But they do have cranberry pills that my dad just started taking. The brand that we were using is AZO. I don't know if it's called Azo. I don't know. Or AZO. So, but those he just started taking too, just to, and one of the nurses was saying that it's better that because it's acidic and the bacteria doesn't like to be in an acid environment.
That makes sense.
Yep. Water is so very, very important. And then there's the tricks of finding ways to get them to want to drink water. How do you motivate someone to do something that they don't want to do? And I do think we'll be discussing this many times. But for my dad's fifth UTI, fifth sepsis, when we yet again had another PT, OT coming into my parents' home and explaining things to my dad. And it did not matter how many times we told him he needed to drink more water. He's like, I am. And he'd be having like hardly anything.
Yeah.
That one of the head PTs came in, physical therapist, I should say, came in to evaluate, to do the initial evaluation before they actually set up what it's going to be, the treatment plan. Exactly. And he had seen my dad before, and he'd been around my mom and dad before. And he was, I think what hit my dad so much harder on this particular time was that the guy was almost cavalier about it.
Yeah.
Like he wasn't like, you must do these things. He was talking and he's like, so I hear you went sepsis again. And dad's like, yeah. My mom's like, that's like the fifth time this year. And he's like, wow. He's like, yeah, that's really bad. My dad's like, And the guy goes, yeah, I just dealt with a woman yesterday. She went sepsis and she died. And so, yeah, it's a very serious thing. And the way he said it, it was like, yeah, you just die. He goes, and it happens like the second you go sepsis, he goes, I mean, it's great that you didn't die because it's very fast. And my dad was like, you could just see his face like, wait, what? Like out of all the time and all the doctors and nurses, he did not hear it until that time. And he started talking about water and about, getting his body up and moving around as much as he's possible, to do, but drinking water and how much water and how important. And then he went through the explanation of what the water does in the system and how it cleans out and my dad was way better after that. And he did not get a UTI for another year and a half.
Wow.
Yeah. So it made a huge difference. And it was the water.
I think you brought up a really good point. When I work with patients throughout my nursing career, they're adults. You have to talk to them about the why.
Yeah.
They're adult learners. You have to say, you got to drink water. Well, think about your own water journey, Lisa.
Right. Right.
You have to talk about why this is important. And then I even have them say, so I gave you a lot of information. You tell me kind of what you're thinking. Like what ideas, well, first of all, tell me what you think about what you heard about the water. So why do you think it's important? And have them repeat that back. And then if they're totally off, because sometimes they don't hear, then put that on yourself because you don't want them to feel tested. Say, you know what? I need to do a better job of explaining. So let me explain it this way. Instead of saying, well, you didn't understand that, you dummy.
Yeah.
If you can say, okay, I did not do a good job on that. And then you say, okay, sounds like you understand why this is important. What ideas do you have? Because if you tell them, okay, this is what we're going to do. I'm going to get you a glass of water and you're going to drink and you're going to tell them and they're going to do this and they're going to do that. They're not going to do it.
Yeah.
But if it's their idea,
yeah,
then it's like, oh, that's my idea. And that's a really good idea.
I think we can do an entire show
on motivation.
And how to motivate your parent.
Absolutely. We'll do that.
Because, people do shows on children and there's a whole issue on how to motivate children. And then people do shows on workers. How do you motivate there's entire books on that. Mm-hmm. Well, this is the same thing. And it might be different than you expect.
It's the change management.
Right.
So it's all the same, but we have to, that's all great. But okay, when you're dealing with your parents, these are some strategies. Yeah.
And there's plenty that we'll talk about that too, is that it's your parents. It's not just motivating an older person.
Yeah. It's
you
your
are
mom.
that
There's
whole
that
role reversal.
Yes.
Exactly. So we're dealing with and again, that will be a whole, that's going to be most of the show is going to It's going to be about how do you deal with the role reversal? How do you motivate somebody who their job was to motivate you? Okay, so when you're dealing with your parent and you have to, one, try to see these symptoms early. And two, we had to have a standing order at the hospital that's a mile away from my parents' house that the urologist gave that order to the hospital that anytime we started going, I think Dad's acting a little funky. Yeah. We just have him do a urine sample. We bring it on in.
Yeah. So you had the cups in your house.
We had the cups in our house.
Oh, that's fabulous.
We absolutely did. And we just would bring it right on in. Yep. No questions. Yeah. Because that was a standing order. That's different than having to have the urologist call every time.
Right.
Because if they're going to get a UTI, it's going to be on a Saturday.
Absolutely.
Or a Sunday.
Absolutely. You can guarantee
that. Or a holiday. A holiday's good too. You could do it on a holiday.
Yeah, that's perfect. When you're gone.
Yeah.
On vacation. Trying to get a break. Well, and the obvious, you have to call the doctor as soon as the stuff manifests. Like Lisa's explaining, this is a long-established relationship, blah, blah, blah. But there's something new for your parents. You have to call the doctor. And if they're like my parents, they're not going to call the doctor. But you have to say, we are going to call the doctor and get an order because we're concerned. And that's just, what's it going to hurt? Right. And we just did this with my dad. I'm trying to think of what was it? He had back pain.
Oh, no way.
And I forgot about this, Lisa. It was this summer. And I said, gosh, I think you have a UTI. And I said, Dad, what's it going to hurt? It was on a Sunday.
We have to do
We were up north.
What's it going to hurt?
And I said, let's just rule it out. And then it was negative. Yay. We're happy. Okay. So let's say it's been diagnosed. Well, you get this antibiotic. All right. You got to take the whole prescription.
Yes.
So many patients that I work with, they're like, hey, I'm feeling better. I'm done. This is a pain. It's giving me a wet, upset stomach. They stop taking it. It doesn't, even if you start to feel better, you got to take the whole thing.
You've actually made the infection grow.
Right.
In that sort. Yeah. Because I remember somebody once explained it to me with antibiotic, and this is true for anything. It doesn't matter if it's UTI, strep throat, whatever.
The whole thing.
Is that the first thing when you put the antibiotic in your body is whatever it is trying to kill grows to fight it. Because it's
will
and that's
prevail. How we got the resistant.
Exactly.
Yeah.
It builds and builds, and it's like the army comes in, they're like, we're going to beat this antibiotic. And then the antibiotic's like, we're going to beat you. And then in the end, the antibiotic beats it, and it goes, If you stop in the middle of that, you've stopped when it's like, we're going to beat the antibiotic. And the antibiotic kicks out of town. And now it's like, wow, raging lunatic, UTI.
Well, and Lisa, you just gave an amazing health literate way to explain to your parents why they have to take their antibiotic the whole time. Seriously, why do I have to do this? I don't get it. Well, talk about the raging army.
The raging army of the UTI.
You have to, and then they're going to get a yeast infection. Yeah. So that's another episode. But
yeast infections.
So yeah. But that's a problem with being on antibiotics.
243.
So call the doctor. Get your pills.
You told me about this today that I'd never heard of, about calling the insurance.
Oh, yeah.
Telehealth or something like that? Okay,
Yes.
Please tell us about that.
Your parents probably are on Medicare or Medicare Advantage plan. So we'll do an episode about that. What you need to do,
Episode
just even see,
142.
see if they even have this type of coverage. But I'm telling you, if you can figure this out, you call their customer service at the insurance company, and most likely they're going to have to be on the phone with you because you have to have permission.
Okay.
So try to do a, conference call on your phone or whatever. They give permission and just say, what is our telehealth benefit? And what this is you do it's on your phone, okay? And the doctor calls you on your phone, you answer it, you do a video face-to-face.
Wow.
And you can say like, hey, this is my mom, she's had bladder infections, blah, blah, blah. And not all the time, it depends, but sometimes they will give you a prescription for antibiotics. So if you establish a relationship with that telehealth provider and, and usually insurance companies will have one provider that they use. They'll say, yep, you have telehealth benefit, and this is a provider we recommend. The problem is the technology piece of that. If you can
technology and our older parents.
Yes, that's but we're not going to talk about that. Let's just pretend they all figured it out miraculously and they didn't need a phone call about the technology piece. But, I'm in Michigan right now and it's literally 3 degrees. I do not want to bring them into an icy urgent care or family physician parking lot right now.
And
I don't want them out.
Mm-hmm.
So that is an option. And honest God, I still forget about that. It's like,
wow.
Oh yeah.
We could just call.
Yeah. So learn about the telehealth.
Yeah. So what you're saying is to call their health insurance, whatever one they've got, whether it's Medicaid or whatever. There's
Medicare.
Sorry.
Yep.
I'm always bad with that.
That's all right.
So it's like a 800 type number that you're going to call. And as you're talking to them, you're going to say, I'm curious what our telehealth plan is.
Yeah, what are your benefits?
And they might say, telehealth benefits, like that. And if they say, we don't have them, you're like, okay, cool. And you hang up the phone. And if they say, we have them and explain, then you go from there.
Yeah, and they'll tell you which one. But you can also call telehealth. Most of them are like $45. Okay,
wait, so telehealth is an actual thing.
Yeah. They're national. There's some really good ones there that, you're going to have to pay privately for it.
Okay.
But the very low charge. Okay, so if I'm at work and I got to take a half day off or am I in a different state, blah, blah, blah. I mean, I'm paying the $45.
Yeah.
Who cares?
So
what
a wonderful way. So you can still take care of something you need to take care of with your parents, even though.
And this is not something for my abdominal pain, they need x-rays.
Right.
I mean, these are like boo-boos, sinus infections. If there's a rash or something, they can look at the rash. But that is definitely an option. People just are not aware of that. It's new technology. But it can be super helpful if your parents are immobile or you're immobile because you're working or you're in a different state. Definitely something to think about.
So with our episode of UTI, there was one story that you forgot to tell, and I definitely want people to hear it because I think it is such an important aspect of knowing that we don't have all the answers ever when we're caregiving.
Yeah. So this happened on a family vacation. When other time would this happen?
Of course.
So we were actually in Florida with our family, just had dinner. We were treating ourselves. We went to this fabulous seafood restaurant. And my dad is extremely allergic to clams. And he gets quite violently ill.
Did you know that before this?
We did.
Okay.
But, he's not going to get seafood. All right. So we're having lunch. My dad's tired. So my mom and I go and get the car. It's a very busy downtown. So we had to park way out. So my husband, Jeff, stayed with my dad because he couldn't walk back to the car. We thought we were going to drive the car and pick him up. My husband called me and I didn't hear the phone. And I joked to my mom. I said, every time I miss a phone call, I think, oh my gosh, what happened? There's this panic, totally overreact, and it's not a big deal. And I thought, I have got to stop panicking every time I miss a phone call. So then my husband calls me back and say, maybe they had to move a spot or whatever, no big deal. Well, it was a huge emergency.
All your paranoia was for real.
Correct. So I can never say it's not a big deal that I missed the phone call. So he said, I don't know what is going on with your dad, but he is shaking violently. And he doesn't know what's going on. He's freaking out. And I thought, he had cross-contamination. He is having a serious reaction.
Allergic reaction.
Yep.
Yeah.
So we run to the car. Well, it's a 2-lane to the downtown, so there we sit. And he's like, how far are you out? This is scary. And it was probably, 5 minutes, but it felt like 30 when those situations are occurring. So there's an urgent care down the road. And of course, we got to get there. We're in traffic, And so we get there. So I come in. I'm a nurse. Right. And I said, I'm sure he's having an anaphylactic reaction. And so I've already planted that. So not a lab was drawn, Give him some Benadryl. You're good. Okay. So he did not respond. A little bit better, whatever. And they said, we don't feel comfortable. We're going to send you to the emergency room. We get to the ED and we say, he's had an allergic reaction. And they said, all right, we're going to watch him. It seems like he's doing better. So we're there, 3 hours, and he had stabilized and did pretty good. So we thought, okay, that was it. Not a big deal. Give us a call when you get better. And next time, how about you call the ambulance? So I'm a nurse, and I didn't even think, that could have gone south really fast if he really was having an allergic reaction. But when someone says call the ambulance, I'm like, well, that's a whole nother level.
That's like heart attack.
And we're not there yet. And which is, that changed my mind about calling an ambulance. That was probably the one story where I'm like, I am going to call an ambulance next time.
Why is it so difficult to call the ambulance?
Because you don't want to make a scene, and you don't want these guys to be like, really, lady?
I know.
But I don't know. But I'm very hesitant to call an ambulance.
Yeah, I am the same way.
So anyway, fast forward, my mom called me and she said, he is not doing well. He fell. He got out of bed, passed out. And then we had that conversation about we should have called the ambulance. And she said, I've already called the ambulance. They're on their way. So I was like, good job, Mom. We zoom over there and we get to the emergency room. And now we're doing the whole workup. And they said, okay, we're not sure what's wrong, and again, he got the shakes again. Okay, so they do all the vitals. They're doing the blood and all this different things, like what's going on? This guy's not doing well.
Yeah.
So come back, ding, 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 ding. He has a bladder infection. Absolutely no signs of a bladder infection. Burning, urgency, fever, nothing. He has a bladder infection. It got into his blood and he went septic, which that causes a cascade of just basically organ shutdown. And if you really are in sepsis, which my dad was, you've got about 6 hours. And there's a whole hospital protocol. And luckily, the hospital had started that protocol.
Wow.
The blood work, the IV antibiotics. And one of the things that the physician said to me is one of the telltale signs, and it's hard with the elderly, is they get confused, which I didn't really see with my dad too much, but it's the shakes.
The shakes. Isn't that crazy?
Then, of course, I'm an RN. So I'm going on a guilt trip. Here we go. Like, how did I not catch this? And then I thought, I shouldn't have gone in and said he's having an allergic reaction. I should have let them explore that more, but I just said, this is what it is. And so I felt guilty about that. So let's just pile that on.
Again, like I said at the beginning of this, we'll never have all the answers.
Right.
And you, as an RN, didn't have all the answers. We can't waste our time feeling guilty. There is so much that's going on from day to day with our parents' bodies, with anything like that, that it's gonna happen, that you're not gonna know, that you're gonna try your best. You did everything that you could that seemed like what it was, and you learned something. So the next time you do better, or the next time we do better, because we hear your story. But the fact is that it doesn't matter who you are. It doesn't matter, I am sure there are doctors out there with their parents who are still not figuring it all out. You know what I mean? And they're like, but I'm a doctor,
But when it's your own family member, it makes a difference.
It's hard to see it.
This is the funny part of the story. So we're stressed out. And my mom didn't quite understand the seriousness of, I mean, this was very serious.
Infection was heading in.
Yeah, he was heading in the wrong direction. And he was actually hospitalized for, gosh, I think it was 6 days. He had to have IV antibiotics.
Wow. Okay.
Then he had to go home with IV antibiotics. Had to be like a 12-day thing. So I'm freaking out. I'm like, my dad is going to die. I look over at my mom, and she likes to crochet when she gets nervous and things like that. And so she started making a dishcloth type of thing. So she's just over there crocheting her dishcloth. Now, the good news of the story is we were there about 6 hours before he got admitted, and she had enough time to make a dishcloth to give to the nurse that took care of my dad.
Isn't that nice?
She did that.
That's adorable.
I know.
I think we have a full bladder on UTIs. We have given a whole weekend.
I can't hold it anymore.
Thank you so much for joining us today. If you liked what you heard, be sure to hit subscribe and also share it with your friends and family if they're caring for their parents too. Thanks again for joining us. Until next time.
Two old friends talking to